Hello and welcome back. In this presentation, we will go over the eligibility criteria in more detail and talk a little bit about how eligibility will be determined. First, let's do a quick overview of the list of criteria, starting with the inclusion criteria. Potential participants must be 18 or older, have moderate to severe opioid use disorder, must have documentation of being newly initiated on buprenorphine during this current treatment episode and being dosed at the target dose or higher. They must be willing to be randomized and agree to comply with the study procedures, must be able to understand the study and sign consent in English, and must agree to taking measures to avoid pregnancy and/or breastfeeding during the course of the study. There are several exclusion criteria, many of which are medical in nature. Potential participants must not have diabetes, must have a BMI of 23 or greater, must not have had any recent serious cardiovascular events, must not have serious digestive or gastrointestinal disorders, must not have personal or family history of two specific thyroid cancers, must not have previous experience with tirzepatide, recently taken any other GLP-1, or had an allergic reaction to any GLP-1. In addition, they must not have serious kidney disease, must not be currently taking or planning to take glucose-lowering medications or systemic steroids, must not have had any suicide attempts in the past year or have current suicidal risk, must not have any condition that would make the study unsafe or make compliance difficult, and must not have any psychosocial issues, including legal problems, that could interfere with their ability to participate in the study. Many of these criteria will be determined through RA assessments, while the rest will be assessed by medical personnel in the study. Immediately prior to randomization, a medical clinician will review all inclusion and exclusion criteria to determine whether the participant is eligible for the study. Some criteria are pretty apparent as to why we are using them. For example, we are only looking at adults, and we only want people who are appropriate for medications for opioid use disorder. That is covered by their being started on buprenorphine recently. We want people to meet criteria for opioid use disorder because that is the population of interest. That is, we want to know if tirzepatide is an effective adjunct to bup for the treatment of OUD. In order to answer that question, we need to have people who need treatment for OUD, which are people who meet current criteria for OUD. We want them to understand the study before they sign consent, and we want to avoid physical or mental health conditions or situations like potential incarceration, which would likely interfere with their ability to fully participate in the study. Other criteria are less apparent as to why they are included, so let's take a closer look at some of those. Information on the candidate's MOUD with buprenorphine status will be extracted from their medical record following completion of a release of information. The inclusion criteria refers to newly initiated on bup within 7 to 80 days during the current treatment episode. This time frame is so we can assess tirzepatide's ability to increase retention during the first few months of treatment, which is when most patients drop out. To be clear, the current treatment episode cannot simply be someone who is transferring care from one provider to another. Although it is permissible for the candidate to have previously taken prescribed buprenorphine, there must be a clear break between the previous treatment episode and the current one. We're defining a new treatment episode as enrolling in treatment with buprenorphine after at least 28 days with no receipt of any form of prescribed buprenorphine. The actual time frame for that will depend on the formulation previously received by the candidate. For daily sublingual, this is straightforward. It is simply 28 days after the last dose. For extended release formulations, however, we must take into consideration the time during which the medication is fully active in the body. For weekly, then, we take 28 days since the last injection and add 7 more days for a total of 35 days since the last dose. For the monthly Monthly, we will add an additional 28 days to the 28-day waiting period for a total of 56 days since the candidate's last injection. This criterion also requires that the candidate be taking at least the recommended target dose for the formulation, which will differ depending upon which product they were receiving. In general, we are looking for the equivalent of 8 mg or greater of Suboxone. This criterion was included to reduce variability in the retention and illicit opioid use outcomes resulting from an insufficient dose of bupe being provided. The chart on screen provides the minimum required dose for the various products currently available. The RA or RC is tasked with obtaining verification on the date of bupe initiation and the current dose, and then reviewing to ensure both the time frame and dosage are confirmed to be in the allowable ranges. They will pass this information to the medical clinician prior to the determination of eligibility. There is a risk that tirzepatide may harm an unborn baby, and it is unknown if tirzepatide passes into breast milk. Because of this, candidates of childbearing potential who engage in sexual intercourse or are planning to engage in sexual intercourse during their study participation must agree to birth control methods throughout the course of the study plus 30 days. Medical clinicians will interview the candidate to determine their childbearing potential using the pregnancy and birth control assessment. Persons who were assigned male sex at birth are not of childbearing potential. Also, persons who have undergone surgical procedures resulting in sterilization, such as hysterectomy, removal of both ovaries, and tubal implants or ligation, are not considered of childbearing potential. Some candidates may have a congenital anomaly, such as a Müllerian agenesis, which renders them infertile and therefore not considered of childbearing potential. Menopausal females may still be able to conceive, so it is important to follow the guidelines for determining whether or not they are of childbearing capacity for the purposes of the study. Menopausal candidates who are considered not of childbearing potential include those 55 years and older who have not had a period in at least 12 months and are not on HRT, those 55 and older who are on HRT but were diagnosed with menopause prior to going on HRT, and those 40 or older with an intact uterus, not on HRT, have not had a period in at least 1 year, and have a level of follicle-stimulating hormone of 40 or greater. This last category must also test negative on the study pregnancy test prior to randomization. Persons not meeting criteria of being not of childbearing potential and who are engaged in or planning to engage in sexual intercourse must agree to use effective contraception. Methods that are long-acting and administered by a medical clinician are considered sufficiently effective by themselves. So this would include birth control injections such as Depo-Provera, IUDs, or birth control implants such as Nexplanon. Otherwise, candidates must agree to using 2 acceptable methods, including contraceptive patches, barrier methods, hormonal vaginal rings, and oral contraceptives. As tirzepatide has the potential to impact the absorption of oral contraceptives, that method alone is not sufficient and must be paired with another method in order to remain eligible for the study. Now, let's see what you've learned so far. Candidates for the study must be within blank to blank days of being initiated onto buprenorphine. Is it 1 and 28? 7 and 28, 7 and 80, or 1 and 80? And the answer is C, 7 to 80. Here's our next question. True or false? Newly initiated on bupe during the current treatment episode is defined as a treatment episode in which the candidate is receiving buprenorphine for the first time ever. And the answer to this one is false. And here's another. Eligible or not? A person who has a pending court case for child custody. Are they eligible not eligible. This person is eligible. Many of the exclusion criteria are specific to medical conditions. Let's take a closer look at those. As a GIP and GLP-1 agonist, tirzepatide's first approved indication was for diabetes. Candidates with existing diabetes diagnoses or whose A1C is in the diabetic range are likely to be taking or need to take other medications with blood sugar regulation properties, so they will be excluded from the study. In addition, they may be randomized to placebo, which would be an ethical issue if they plan to rely on the study medication to treat their diabetes. Tirzepatide has also been found to induce mild hypoglycemia. For this reason, participants need to have an A1C lab result of at least 4.5% to be eligible for randomization, and adverse events will be assessed at the weekly study visits. If a study BMC believes that a study participant may have symptomatic hypoglycemia, blood glucose will be assessed with a blood glucose meter. Symptomatic hypoglycemia is defined as the presence of classic symptoms of sweating, shaking, fast heart rate, or confusion that is alleviated by eating food, juice, or sugar. If the participant's glucose reading is less than 70 milligrams per deciliter, their study medication will be discontinued. Severe hypoglycemia is rare with this medication. However, all randomized participants will receive education regarding symptoms of hypoglycemia, how to treat mild symptoms, and when to seek emergency help. Tirzepatide is also FDA approved for weight loss, which may be beneficial for participants who are overweight or obese, but significant weight loss in patients of normal weight could lead to issues including electrolyte imbalances. For this reason, participants need to have a BMI of at least 23 to be eligible for randomization, and weight will be collected at the weekly study visits. As a reminder, study medication will be discontinued if the participant's BMI drops to 20 or lower, but may be restarted at the lowest dose should it increase back above 20. Tirzepatide is not known to cause cardiovascular issues. In fact, it has been associated with a reduced risk of major adverse cardiovascular events. However, persons with significant cardiovascular events in the past 90 days may have ongoing safety issues that could be problematic, and similar exclusions have been used in past tirzepatide trials. To ensure the participant's safety is not affected, we will be ruling out persons who have recently experienced one or more of these significant cardiovascular events. The most common side effects of tirzepatide are gastrointestinal, including nausea, diarrhea, vomiting, constipation, stomach or abdominal pain, indigestion, belching, and heartburn. More serious problems such as acute pancreatitis, gallstones, and inflammation of the gallbladder are rare, but potential side effects of the medication. We do not want to potentially make existing problems worse due to known side effects. So, persons with these more severe digestive and gastrointestinal problems will be excluded. Regarding gastroesophageal reflux disease, or GERD, a lot of people have heartburn now and then, and with current pharmaceutical advertising, they may mistakenly diagnose themselves as having GERD. For TAB, ineligibility for GERD would occur only when 1. The person has received a formal diagnosis of GERD from a medical clinician, and 2. The person is taking medication such as prescribed or over-the-counter like Prilosec or Prevacid or Zantac on a daily basis to deal with their symptoms. It's also important to note that if the person had their gallbladder removed, then they would be eligible despite a history of gallbladder disease. In rats, tirzepatide causes thyroid C-cell tumors, but it is unknown whether it causes thyroid C-cell tumors, including medullary thyroid carcinoma, in humans. So, tirzepatide is contraindicated in patients who have a personal or family history that is first or second degree relative of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, and these conditions are exclusionary for the study. To assist with blinding, we do not want to include anyone who has previous experience with tirzepatide. We also don't want to include anyone who has had allergic or hypersensitivity reactions to other GLP-1s due to an increased risk of the same with tirzepatide. In order to further protect the blind, we will exclude anyone who has taken a GLP analog within the 6 months prior to consent, as well as anyone who has taken similar medications such as the sulfonylureas, insulin, metformin, TZDs, DPP-4 inhibitors, and SGLT2 inhibitors like Jardiance and Farxiga. Conversely, systemic steroids like prednisone and hydrocortisone have the opposite effect on blood glucose levels, which could potentially interfere with the effects of tirzepatide. Therefore, anyone taking systemic steroids within 30 days of consent will be excluded. Medical clinicians will need to elicit information about prior and concomitant medications during screening and carefully consider whether any reported medications fall within these exclusionary categories. Tirzepatide can cause dehydration due to side effects such as nausea, vomiting, and diarrhea, which may lead to acute kidney problems. eGFR labs will be drawn at screening, and abnormally low values will result in exclusion. Results must be available prior to the final determination of eligibility for randomization. At screening, RAs and RCs will screen for a history of suicidal behavior using the PRISM. Unless there is compelling clinical rationale otherwise, and it is approved by the lead investigator, a participant will be excluded for items on the PRISM indicating a suicide attempt in the prior year. In addition, the candidate will be completing the PHQ-9 and HADS at screening. Any indication of suicidal ideation will require administration of the CHRT clinician-related behavioral module to determine if there's a current suicidal ideation that would cause an exclusion. Finally, the medical clinician performing the medical and psychiatric history will assess for past and current suicidal behavior and ideation as part of that interview. Now, let's do a few more review questions. Eligible or not? A person diagnosed with GERD who is managed with over-the-counter Prilosec on a daily basis. Are they eligible or not eligible? This person is not eligible. Here's the next question. Eligible or not? A person who attempted suicide 5 years ago following a divorce. Are they eligible or not eligible? This person is eligible. BMI must be at least blank to be eligible for randomization. Is it 23, 18, 25, or 20? And the answer to this question is A. The BMI must be at least 23 to be eligible for randomization. Now let's look at how we will be confirming eligibility. Following the completion of the baseline assessments, the RA or RC will perform a final review of the participant's eligibility as indicated on the ENRC enrollment form in eClinical. Any questions or concerns about randomizing the participant should be discussed with the PI or their designee and/or a study medical clinician at this time. Once all screening and baseline assessments have been completed, or once the ENRC indicates that the participant is not eligible, the BMC or UMC must make a final determination of eligibility. Whether the participant is eligible or not, the BMC or UMC must complete the MC eligibility checklist progress note to provide the final determination of eligibility. Only participants who meet all inclusion criteria and no exclusion criteria will be offered the opportunity to be randomized. following administration of all screening and baseline measures, and just prior to randomization, the BMC or UMC should review the eligibility checklist and meet briefly with the participant to confirm their eligibility for randomization. Remember that if the BMC or UMC is not a physician BMC or UMC must review the medical history CRF and sign as part of that determination of eligibility process. The RA or RC will provide the medical clinician with a number of source documents to review, including the lab results, the paper source for the pregnancy test, if any, printouts of the PRISM, HADS, and PHQ, as well as any CHRT clinician reports that may have been completed by the QMHP, the prior and concomitant medications form, and the medical and psychiatric history form. If any adverse events occurred since consent, the RA will provide the paper versions of those reporting forms as well. The RA or RC will pre-fill the areas under inclusion-exclusion criteria with the answers that match what is in the ENRC and eClinical and provide that to the reviewing medical clinician. The medical clinician will then review all source materials provided to ensure that they agree with the answers in eClinical and will meet briefly with the participant to ensure there have been no changes since screening and to clarify any outstanding eligibility concerns. The red arrows indicate areas that must be completed by the reviewing medical clinician. Once all criteria have been reviewed, the medical clinician will state yes or no to the questions at the end of each criterion list, and then will answer yes or no to the question, is the participant eligible for randomization, marking the date on which the eligibility was determined. This procedure must be followed whether the candidate is eligible or not. For candidates who rule out prior to the baseline visit, the RA or RC will provide the medical clinician with the information gathered up to that point so that the medical clinician can confirm the rule out and complete the checklist accordingly. This form gives the medical clinician a list of what to give back to the RA or RC, who then documents the date that they received it back from the medical clinician. Finally, the medical clinician will document any unusual circumstances that impacted their determination of eligibility, or check the box if there was no additional relevant information. Once the MC signs and dates the checklist, the candidate will move on to randomization if eligible. Thank you for joining me for this presentation on assessing eligibility. Please feel free to reach out to the lead team with any questions.